A huge wave of infections could rip through the country and claim more than 300,000 lives if Brits give up the coronavirus fight, according to one expert. Dr. Andrew Lee has warned that the second coronavirus wave could be far more devastating than the first if Brits down tools and the effort against the deadly bug. According to his worst-case scenario, 330,000 people could be killed by the disease if social distancing is discarded, face masks are ditched, and life goes back to normal. If things continue as they are in the most areas of the country with some measures in place, then 120,000 people could die this winter, warned Dr. Lee, a public health expert at the University of Sheffield. The bleak forecast comes days after thousands of people broke social distancing rules to protest against their freedoms being limited by the Coronavirus Act. And despite hefty fines being introduced for those breaching coronavirus rules, dozens of videos have emerged this week of people partying in the streets after pubs closed at 10 p.m. Around 200 people were caught on video singing and dancing in Coventry yesterday. When asked what might happen if Brits gave up the coronavirus fight, Dr. Lee told Mirror Online, "If you lifted all restrictions and went back to normal, we would get a very big wave, much bigger than the first wave. This wave would rip through the population over several months until about half the population gets infected before it slows down. For the lower risk groups, you won't see too much in the way of deaths, but if you infect enough you will get deaths in those groups. If we do some rough calculations, the current death rate is around 1%. If you need to get 50 to 60% of people infected to reach herd immunity, then that's 330,000 Brits dying. In that situation, the NHS would almost certainly buckle under the enormous strain of people needing critical care. In a sign of the difficult winter months facing the healthcare workers, whatever the government's strategy is, one hospital has already had to cancel all operations but urgent cancer surgeries. People needing emergency care will be diverted away from the Royal Glamorgan Hospital as of today after a suspected super spreader event led to an influx of patients and 8 deaths. If the daily death toll reached into the several thousands, as would be the case in a worst-case scenario second wave, then the demand for intensive care beds would far outstrip supply. That is likely to be the case despite significant advances in treatment of the virus. Analysis of NHS records shows that 34% of intensive care admissions were dying of the virus in July, down from 44% in March. People in Europe are now spending around 10 days on average in ICUs, rather than 21 days during the spring, according to Marcel Levi, Chief Executive of University College London Hospitals. That means capacity has effectively doubled. The government has also spent £569 million buying 20,900 ventilators to keep people alive, far more than was needed by the 3,300 Brits needing mechanical help breathing at the peak of the first wave in April. In addition, there is now a 4-month stockpile of PPE made up of more than 30 billion pieces of kit available to the NHS. Even with these steps forward, Britain is facing a torrid winter. The figure that I feel is fairly realistic for a worst-case scenario is one detailed by the Academy of Medical Scientists report back in July, which is 120,000 deaths. Dr. Lee continued. That is for a winter wave peaking in January, if we continue on as we are now with some measures in place. In the winter the virus will thrive, because everyone is indoors, there is much closer contact, people don't open windows. The NHS is really going to struggle. Not only will the NHS struggle, it will struggle to keep its usual routine surgery going. X-rays, surgery for people with dodgy hips, it will be very difficult to run. Dr. Lee is hopeful that the number of deaths can be kept far lower if Brits follow social distancing restrictions, wear face coverings and isolate properly. A lot of NHS leaders and public health leaders are keen for the public to be sensible about it, he continued. If everyone in the UK sticks by the rules, we won't get to the 120,000 figure. If we get our act in gear it could be much lower. We can do much better as a country, but it needs everyone to chip in. Unfortunately, the public health message gets tarnished because it is associated with the government. I hope people can make the distinction and treat the advice positively. I don't necessarily believe in draconian measures. We need to appeal to everyone's goodwill and public-mindedness. If we do, we will get through winter and keep the infections low.